So welcome to Chapter 4, Common Cardiovascular Diseases and Disorders. So it's important to understand the kind of diseases and disorders that patients will come in for so that you better understand why you're doing the EKG so that you have a better understand with communicating and transferring information to patients. Basically, the patient education part, because a lot of them have questions, and sometimes they'll feel more comfortable asking you those questions because the doctor or the nurse is too busy, or they're just not interested in explaining to the patient. They may ask you, and you, as the EKG semi-cardiac expert, you can definitely answer those questions to try to help them. So as always, here are the definitions that you want to make sure that you're familiar with. So remember these points about coronary artery diseases. So remember where your coronary arteries were and what they were used for and what they transport. So it occurs when arteries supplying the heart muscle become narrowed, thickened, and hardened by the buildup of fatty deposits. Can cause increased blood pressure and decreased blood flow to the heart muscle. Also poses danger of plaque loosening, traveling, and then blocking the flow of blood to crucial locations. So here are some pictures of how plaque buildup can look inside of the vessels. So before we even get into it, what happens if that vessel closes up, like with plaque? Think about what cardiac condition happens, and then you'll kind of understand why. Particularly in minority populations, they consume a lot of fatty foods and foods that are classified as unhealthy. They consume a lot of those products, which leads to plaque buildup. So think about what happens when those vessels close off. What is that called? So ischemia, which is the condition um, when the coronary artery gets blocked, which results in a lack of oxygen to the heart muscle. Angina, think about what that means. That's going to be chest pain. So cardiac output, if you hear someone say, oh, this person's cardiac output is this, that's the amount of blood pumped by the heart. And cardiac arrest, definitely know what that means, because if you hear that, that's going to be your code situation. You most likely won't be in that situation. As the EKG technician, you'll probably step out the room, or they could ask you to do compressions if you're the first one in the room, or if you were doing an EKG and they go into cardiac arrest, you may have to start compressions until the appropriate personnel gets there. That's why we have to have everybody trained in BLS. So ischemia and myocardial infarction. So we just talked about a little bit about what happens when that plaque builds up. So that's going to be a myocardial infarction. What does that mean? Ischemia, we talked about that. What does that mean? A myocardial infarction usually occurs with a blocked artery. So ischemia can cause chest pain called angina pectoris because the heart muscle is not receiving enough oxygen. This situation is usually made worse by exercise or stress, since these things can cause the heart to work harder. If angina occurs without exertion or stress as a trigger, it is called unstable angina. And unstable angina may indicate that atherosclerosis is getting worse and there is a greater chance of an MI. So what does MI mean? So as an EKG technician, you should be aware of these signs and symptoms of low cardiac output. What does cardiac output mean? Fatigue, changes in level of consciousness, weak pulse, cold or cyanotic extremities, and then low blood pressure. So signs and symptoms of myocardial infarction. So angina pectoris, diaphoresis. What does diaphoresis mean? Nausea with or without vomiting. Weakness, dyspnea. So what does that mean? Neck, jaw pain, pain radiating to the arm, the feeling of impending doom, decreased level of consciousness, and then finally cardiac arrest. So it's important to recognize these symptoms and report them to help reduce harm caused by MI and eventually cardiac arrest. It's also important to remember that not all patients experiencing an MI will demonstrate all of these symptoms or the best known symptoms. Specifically, women may experience different symptoms such as shortness of breath, lightheadedness, fatigue, or flu-like symptoms. So women are more likely to not experience chest pressure and to deny that they're having a heart attack until something major happens and they go in and find out that yes, it wasn't a heart attack. So recognizing and reporting these signs and symptoms can reduce the harm caused by an MI and prevent cardiac arrest. So here are some of the symptoms that other symptoms that people may experience, particularly women. So as a patient has just put on a gown in preparation for an EKG. When you enter the room, you see that the patient is sweating and notice she is short of breath. She says that she feels fine. How would you respond to this situation, knowing what you just heard related to women and symptoms of a heart attack? Like, what would you do next? So here are some terms related to cardiomyopathy. So what is cardiomyopathy? So cardiomyopathy is the muscular layer of when the muscular layer of the heart is enlarged. So the muscular layer of the heart is enlarged. The enlarged heart cannot pump effectively. The situation can cause valve damage and can increase pressure on blood vessels. Fluid buildup in the lungs and body tissues results from decreased circulation. It causes include advanced age, alcoholism, and heredity. And treatment includes medications to strengthen the heart and eliminate excess fluid. So remember these points about cardiomyopathy. These are the ones that I just went over, but I feel like it's helpful to go over it with the picture so you can kind of picture it as well. But here exactly are the notes that I just went over. So what are some signs and symptoms of cardiomyopathy? So fatigue, lower extremity edema, dyspnea, arthralgia, weakness, fatigue, and then lower extremity edema. So congestive heart failure. Congestive heart failure is a condition in which the heart muscle is damaged and is no longer able to pump effectively. It causes blood to back up in various parts of the body. So remember that congestive heart failure can be caused by different conditions such as myocardial infarction or hypertension. It can affect the right or left side of the heart. Right-sided CHF causes blood to back up in the veins, returning blood to the right atrium and in organs that filter the blood, such as the liver and spleen. Left-sided CHF causes blood to back up into the pulmonary veins. Untreated left-sided CHF eventually causes right-sided CHF. Signs and symptoms of right-sided congestive heart failure. So liver congestion, spleen congestion, ascites. So what does ascites mean? And lower extremity edema. Signs and symptoms of left-sided heart congestive heart failure. So know the different signs and symptoms for left and right. So left side is going to be edema of the lower extremities, tachycardia, dyspnea, orthopnea, neck vein distension, productive cough with frothy sputum. So what does sputum mean? What is sputum? So heart valve disease, you have regurgitation. What does regurgitation mean? The leaking of blood back into the chamber from which it is being pumped, also called backflow. So the function of the heart valves is to keep blood flowing properly through the heart. Damaged or poorly functioning valves can allow regurgitation. Regurgitation makes the heart work harder to pump. And if it's working harder to pump, it can lead to other things such as an MI. It can also increase the risk of blood clots. Valve damage may be caused by some infections, or valves may be impaired due to congenital defects. So what are some signs and symptoms of heart valve disease? So cough, chest pain, weakness, palpitations, abnormal abdominal swelling, weight gain, weakness. So describe the blood clots and possible complications. So here are some definitions. CVA. What does CVA mean? Blood clots may form in the following situations: when blood flows through the damaged arteries, when blood pools in the heart or in the veins of the lower extremities, when a person has a medical condition that increases the risk of blood clots. So remember these points about the possible complications of blood clots. Tissue supplied by the blocked vessel dies. Amount and severity of damage depends on the location of the clot and how quickly it is treated. Clot can travel from its original location and cause greater damage. So deep vein thrombosis signs and symptoms. So just make sure you're familiar with the signs and symptoms of a DVT, just in case if you see questions related to this. So remember, a DVT can be very dangerous if the clot moves to the lungs. Symptoms may not be present until the clot moves to the lungs. So pulmonary embolism, which is another name for PE. PE can show up with these signs and symptoms. So a sense of unease, cyanosis, dyspnea. What does cyanosis mean? And chest pain. So these signs and symptoms can lead to other things. If the clot decides to move and blocks, let's say, an artery, what could that cause? It could cause a CVA or MI. So just keep that in mind. So clots can also form within the arteries. These clots are also dangerous and can cause myocardial infarction or cerebrovascular incident. So CVA, otherwise known as a stroke. So these are the signs and symptoms. Think about if you ever saw anyone that had a stroke, how did they look? How did they present after they had the stroke? What happened? What did they do immediately? What happens when you go to the hospital if you have a stroke? So prompt attention and treatment is essential for reducing the damage caused by a stroke. So immediate intervention, oftentimes you see them go in and they administer a clot busting agent. Most of the time it's TPA, but there are other medications they could administer as well. They administer these medications rapidly through IV so that the clot can break up and there's not long-term major damage. There still may be damage, but it may not be long-term major damage. So hypertension. So it can be a chronic disease of its own or a sign of other diseases in the cardiovascular system. It can occur without noticeable symptoms. Untreated hypertension can cause stroke, heart failure, or kidney damage. Risk factors include the following: smoking, obesity, diet high in fat or salt, stress, family history of hypertension, African American heritage. Treatment can include medications, monitoring, and then lifestyle or diet changes. So exercise or diet changes. So here are some signs and symptoms of hypertension. So as always, here are the chapter review questions. Just make sure you take some time and answer these questions. Think about the terms that were mentioned in this chapter and how they can help you be successful on your certification exam and understanding what's going on inside of their environment, inside of the workplace. So it says, which of the conditions described in Chapter 4 requires fast action to reduce damage? And then how can EKG technicians help patients receive help quickly when they need it?